Hello, and a very warm welcome. We're going to spend some time together talking about something that is so common, but so often goes unspoken: painful intercourse. I just want you to know right from the start that this is a safe place. Our whole goal here is to gently walk you through what might be happening and show you that there is kind, compassionate help out there.
So, before we dive into any of the medical details, let's just pause and talk about feelings. Because let's be honest, the idea of even seeking help for this kind of pain can bring up a whole lot of anxiety, maybe even fear.
Let me just ask you, straight up, does the idea of a pelvic exam, especially when you're already hurting, fill you with dread? Does it make you want to just avoid the whole thing completely?
If you're nodding your head right now, please hear me when I say this. You are so far from alone. And those feelings? They are 100% valid. They make perfect sense, and any good clinician will understand and respect that completely.
Okay, so let's talk about what good, compassionate care really looks like. The first and most important thing to know is that the journey to figuring this all out starts with you. It starts with your story. It starts with a conversation.
I just love this quote from the Women's Health Clinic. It really gets to the heart of everything. Their whole philosophy, which is really championed by doctors like Dr. Farzana Khan, is that the most powerful diagnostic tool isn't some medical instrument, it's the simple act of listening to you.
And here's something that might feel like a huge relief. Sometimes that conversation is all that's needed to get started on a treatment plan. You know, if your story clearly points to something hormonal, like dryness around menopause, or maybe the pain started after you had a baby, or if you already know you have a condition like endometriosis, a plan can often be made right then and there without needing an exam right away.
Now, of course, there are definitely times when an exam is a really helpful next step, but I want us to think about it differently. It's not this scary hurdle you have to clear to get help. It's just another tool in the toolkit that can give us more clarity when we need it.
So an exam really becomes useful when your story doesn't make the cause obvious, or if your doctor suspects there might be an infection going on. It's also really helpful if the pain is deeper, or if the first things you've tried just haven't worked. And of course, it's really important if there are any red flag symptoms, like unusual bleeding, just to make sure everything is okay.
So if an exam is the next best step, let's talk about what a gentle, modern exam actually feels like. Because here's the most important rule. It happens completely and totally on your terms. This is all about putting you back in the driver's seat.
Okay, let's bust a huge myth right now. So many of us hear pelvic exam and we immediately think of a smear test. But a pain assessment exam is a world away from that. It is so much gentler. They often use tiny little pediatric instruments, tons of lubrication, and the entire goal is to understand your pain, not create more of it. If anything starts to hurt, you just say the word and everything stops, period.
And here is such a simple and powerful way you stay in control. It's called the traffic light system. It's so easy. You just say green when you feel okay to keep going, you say amber if you just need a second to pause and breathe, and you say red to stop immediately. And red means stop, no hesitation, no questions.
And there are even more ways to keep you in control. You can actually choose to guide the speculum or the doctor's hand yourself, which for many women is really empowering. You can also ask for a mirror so you can see exactly what's happening. It takes all the mystery out of it and can really help with anxiety. Let's just sit with this for a moment, because it's the most important thing. This is the bottom line. You have the absolute, undeniable right to say stop at any time for any reason. Your body, your rules. It's that simple.
This whole philosophy of putting you first, it's the absolute standard of care at the Women's Health Clinic, and it's really embodied by wonderful clinicians like Dr. Farzana Khan, who has really shaped so much of this gentle, patient-led approach.
And just so you know, you're in incredibly capable hands. Dr. Khan's expertise is just phenomenal. She has a medical degree from the University of Copenhagen and then specialist qualifications from the Royal Colleges in both general practice and in sexual and reproductive health.
And, it's not just about qualifications on paper. We're talking about over 20 years of hands-on experience in areas like gynecology and obstetrics, all focused on one thing: helping women with their health.
But honestly, beyond all the credentials, it's her approach that I think is so special. Her entire practice is built on these three pillars. First, clear explanations, so you are never in the dark. Second, realistic expectations, so you know what the journey ahead looks like. And third, shared decision-making. That means you are an equal, respected partner in your own healthcare, always.
So, now that we've talked all this through, let's look at your path forward. Let's talk about some gentle, empowering steps that you can actually start taking today.
Even before you step into a doctor's office, there are some really helpful things you can do. You could start a little symptom diary to track when the pain happens. That information is like gold for your doctor. You can also practice some gentle, deep breathing to help relax your pelvic floor. We tend to hold so much tension there. And if you think dryness might be part of the picture, using a good, non-hormonal vaginal moisturizer regularly can make a world of difference.
And please, if you take just one thing away today, let it be this. You can always book a talk-only appointment first. It is such a brilliant, no-pressure way to just meet a clinician, tell your story, build some trust, and get your questions answered before you even think about an exam.
So, I'll leave you with this to think about. Just imagine, for a moment, what your health journey could look like, what it could feel like if from the very first moment you felt safe, you felt in control, and you felt truly, deeply heard. That's not a fantasy. It's exactly what you deserve.